But I am optimistic. Why? Because we control our destiny. Because at its very core, we have a generational opportunity, a unique ability to save the healthcare system because we control all the big pieces. America is too great for small dreams. So I've got some big ideas.
So there you go. Let's hear about the big ideas right now. Being sworn in to head the Centers for Medicare and Medicaid, laying out a vision for the agency that insures more than 160 million Americans. The doctor is in, CMS Administrator Dr. Mehmet Oz, and congratulations on the gig, and thank you for spending time with us today on America's Newsroom. Good morning. Huge job, by the way. Said 160 million Americans touched by CMS, $1.5 trillion in spending. This is a massive job. In a line or a sentence, what is your mission as you go into this?
My mission is to protect the most vulnerable, because I'll tell you, as a heart surgeon, the most expensive care is bad care. You got to pay the person who's doing a bad job. You got to pay someone else who's capable to fix the problem, and you got to pay for the complications. And there's so many things we can do to improve care in America. And folks watching this program are probably witnessing and pretty good testimonials out there about what has been done in the past that's not worked well. But here's the good news. We can empower beneficiaries, give you tools, and that's coming down the pike at you. We can make sure providers have better opportunities and incentivize them to do the right thing, because oftentimes in CMS, we've unfortunately gotten folks to do things wrong because we pay them for doing things incorrectly. But right now, my main focus, without any question, is to wage a war on fraud, waste, and abuse.
Okay.
Because that's what's required. All hands on deck. It's a massive issue. You know, hundreds of billions of dollars potentially out there. Not all of it's going to be collected at once, but we've got a war room right now focused very much on things that are going to really bother you. If you thought USAID was a problem, some of the issues that we are discovering, some of the things that CMS has been funding through Medicare and Medicaid and the exchanges will bring a little shiver to you.
Okay, let's get into it, because Democrats are going at you in a big way. Demonizing all this stuff. Just play a clip here, okay, and I'll get into specifics after this.
Every American will be more vulnerable to President Trump's agenda that prioritizes the billionaire class over the working class as he cuts Social Security and Medicare and Medicaid.
I can fight these proposed cuts to Medicaid that Donald Trump wants.
An assault on the economy, on Social Security, on Medicaid, an assault on the democratic way of life.
Voting to advance cuts on hundreds of billions of dollars from Medicaid and veterans benefits.
So, I mean, this is a song they're singing, and you're going to have to defend it. Elon Musk said this a couple of months ago. This is where the big money fraud is happening, talking about what's happening in Medicare and Medicaid. Can you say today, are you cutting Medicaid, as Democrats claim, and will continue going up to midterms next year?
President Trump has been very clear with me. He said it publicly. He wants to love and cherish, I'm quoting him, Medicare, Medicaid, these programs. We are focused on saving Medicaid. That's what we've got to do. That's the existential threat, that you spend it into the ground and we don't have the resources to take care of our most vulnerable. I'm sitting right now in the Humphreys building, which is the Health and Human Services building. Bobby Kennedy and I basically live here now. If you walk in the building, there's a quote from Hubert Humphrey. It says it's a moral obligation of government to take care of people who are in the dawn of life, children, people in the twilight of life, mature seniors, and people who are in the shadows, those with disabilities. To do that, you have got to make the system work better. And Democrats should be cheering us on, because we're going after problems that have plagued the system that people have not dealt with for the last 4 years. I'll give you a couple examples, Bill, simple ones. $1 billion spent, Medicare money, taxpayer money that should have gone to impoverished children and seniors struggling with the illnesses that you get when you get older. And this $1 billion went because people were registered in multiple states on Medicaid at once. So you're paying a lot of states, even though they're not living in those states anymore. We've got $200 million spent on housekeeping services. Is that part of the charge of Medicaid? $10 million spent on student loans from Medicaid. That could go to saving people who have sickle cell anemia with gene therapy that's remarkably effective in completely reversing a disease. $3 million on DEI, and another $11 million on labor unions' child care benefits. I mean, come on. At a certain point, you look up and you say, you must be kidding. How can someone not have dealt this?
So Doge goes goes in.
250,000 people
Yeah.
were
So-
registered in the marketplaces who shouldn't have been.
God, so Doge goes in. What's the expectation for savings from Doge? Give us a number today based on $1.5 trillion in spending.
We've already discovered, just since I've been here, and even before, since the inauguration, tens of billions of dollars that is of fraud easily taken back. We just stopped recently a couple $100 million going out the door that would have actually been taken by folks, and who knows where they're taking the money when they get it. These people are not involved in legitimate activities. So the $31 million that I know of last week is a great example of this. We stopped the money by using new technology, by modernizing how Medicare and Medicaid works from even leaving the building, because we knew something was fishy about these bills. And these aren't just small little mistakes. These are organized criminal efforts to hurt our country, some of them launched by foreign countries. So these are issues we want to get into the weeds on, and that's why we have this war room. And before I forget, Bill, this is important. This is all hands on deck. If you have a tip, call us at 1-800-HHS-TIPS or cms.gov/fraud. We need your help. You will identify problems. If you see something, say something.
Okay. This program was designed for poor kids, pregnant women, the elderly, and disabled. And you're saying today that those categories will not be affected by what you're doing. Is that what I hear?
You hear absolutely correctly what I'm saying. Is what the president has reflected as well. The people who were supposed to be supported by Medicaid when the program was first designed in 1965 will continue to be helped. And if we don't make some of the changes by reducing fraud and waste and abuse now, we're putting those young people, those old people, and the people in the middle who are in the shadows in trouble.
All right. A lot of people are watching. Thanks for coming on. Let's speak again, okay? It's too big a category to conquer in 5 minutes. Thank you, Doc, for coming on. Appreciate it.
God bless you. Love the data.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.